I need to use your chair so I can finish my work.
I'm in the middle of my charting. Surely you could find another chair. I think there's one in the storage room over there.
How about you take your charting and do it over there?
Hello, Anna. What brought you here today?
Hi, Anna. Well, I have a problem with Dr. Lameness. He has shown outrageous disregard for nurses and our duties.
What happened?
Well, I was in the middle of my charting when Dr. Lameness came up, and since I didn't give him my chair, he threw my chart down the hall.
Well, you know your doctor is your ultimate authority. You should have given him the chair and find somewhere else to do your charting. Your doctor is more important. His job is more important than yours.
Well, I think our duties are just as important as his. I think it's time to go back to school. Thanks for all your help.
During the late 70s, nurses were treated unfairly by doctors. Although they had education, they were treated as nobodies. We rejoin our nurse as she is about to enter the counselor's office at a nearby school.
Hello, what brings you here today?
Hi. Well, I was wanting to go back to school to get my RN license. I already have my LPN license.
Alright, well you come to the right place. I can help you with that. We have 3 different options for the RN license. You can do the diploma degree, and you go to the hospital and you have lots of hands-on experience. You also have the bachelorette degree. It takes 4 years to acquire that, and you'll have your BSN afterwards. You can do your associate degree. It takes 2 years to acquire, and you have to pass the NCLEX exam before you can be an RN. Here are some of the best universities around. We have the Thomas Edison State College, and we also have the Mercer University College in Georgia. These are just a few schools to name, so if you have any other questions about schools, just let me know.
Okay. I think I want to know more information about the associate's degree.
Okay?
And completed her program in the NCLEX exam. The nurse is now ready to rejoin the workforce as an RN. 20 years later, we rejoin the nurse. Now, thanks to the Nurse Licensure Compact, she can work in any state that has signed the compact without having to reapply for licensure.
Dr. Awesomeness, I'm getting ready to go to Anna's room to prep her for surgery.
Well, I have something to do real quick. If you could just go in there and explain the procedure to her real quick, get her to sign this form for me, that would be great.
Doctor, that's out of my scope of practice. I can witness her signing this paper, but I'm not allowed to explain the procedure to her.
Fine, I guess I'll go finish what I was planning to do later. I'll be right in. Hello, Anna. How's it going? How are you today?
I'm doing okay.
Good, good. Well, we're just getting everything set up to put your arm back in place. If you have any questions before we put you under to begin the procedure, now's the time to ask.
I have a question. I would like to know how long is it going to take to recover, and how long am I going to be in the hospital?
Well, you should actually be out by tomorrow. The recovery phase is about 6 to 8 weeks, along with a few intermittent visits to your primary physician. All right, well, the nurse will be in shortly with your paperwork, and I'll be right back. So, Irina, how's Anna doing today?
Well, she seems to be anxious about her surgery, but she seems to be doing a little bit better since you're talking with her.
Yeah, I assigned her some PRN pain medication. Has she been taking that?
Well, the pharmacy has not filled her order yet.
Okay, so she's still in a lot of pain.
Well, she's getting the pain medicine we're giving her.
Oh, good. Thanks to Florence Nightingale, nursing is now a respected profession. Where it once was nothing but women, socially obligated to care for the sick and elderly, it is now accredited with professional degrees on the subject. The nursing profession has also incurred many new responsibilities to individualize itself within the healthcare field. As seen in this video, the nurse has many responsibilities when it comes to their scope of practice in infection control. This is the primary goal of not only the nurses, but it also applies to all people within the medical field.